pictures that gives the all the branching arterial tree. Let's move on to the veins of the head and neck. Veins of the head and neck. Overall, the veins of the head and neck, they may be divided into the veins of the brain. These are the veins that are supplying inside the cranial cavity, and they are cerebral veins, brainstem veins. We are not going to discuss those. There are venous sinuses, dural venous sinuses. That's a whole other topic. Diploic veins, the veins that runs between the two tables of the calvaria, and then there are emissary veins, then the veins that are passing between the veins of the dural venous sinuses and the veins on the top of the skull. So these are the veins of the head and neck. And then there are a number of veins of the scalp or face: the facial veins, superficial temporal veins, maxillary, retromandibular, external jugular, anterior internal jugular, subclavian vein, that we are going to discuss right now. Okay, so these are the set of veins that we are going to discuss. This is the diploic veins that are running inside the two tables of the bone, the calvaria. These make an anastomosing network, and they are not very properly labeled, properly defined, but because they make a very vast network of veins, let's discuss these. Let's start from here. I think I did one. I Okay, we will discuss facial artery with the face inshallah tomorrow. Okay, facial veins. Facial vein will be the one that will be on the anterior aspect of the face. It will have a similar pathway to the facial artery. It will be running from here, from the medial aspect of the ear, on the lateral aspect of nose to the lateral aspect of face, and it will come here and down to the internal jugular vein. So this is the facial veins, and superiorly facial vein is being made by the fusion of the supraorbital and supratrochlear veins, and they make join to form the facial vein, and they come down and they move from the lateral aspect of nose to the lateral aspect of mouth, and they go and they join with the lingual vein, usually to form the common facial veins, and they drain into the internal jugular vein. Okay, that is the lingual vein and internal jugular vein is formed. The interesting thing that is to be seen here, we have not discussed yet the dural venous sinuses, but the facial vein, it is connected to the ophthalmic set of veins, to the superior and inferior ophthalmic veins, to the cavernous sinus. So the facial vein is connected to the cavernous sinus. So its implication is that there is the infections from the face, the trauma, the pathogens entering from the face can go through these ophthalmic veins and go to the cavernous sinus to create a cavernous sinus thrombosis. So this is about the facial vein, and then there is this superficial temporal vein. This is a similar one that had the artery, and it receives the maxillary vein to the superficial temporal vein, like here, and where the maxillary vein joins the superficial temporal vein. Now, this is called the superficial temporal vein. It joins the maxillary vein, and now it is called retromandibular vein. Just be aware of the fact that here the names and the arrangement does not correspond very nicely to the arterial system. Originally, external carotid artery was dividing into maxillary and superficial temporal, but in case of veins, the superficial temporal veins and the maxillary vein, they join to form the retromandibular vein. When the retromandibular vein comes down just behind the angle of the jaw, here it divides into two parts. The one that is going anteriorly and posteriorly, these are simply called the anterior and posterior divisions of the retromandibular vein. Okay, the anterior division of the retromandibular vein, it joins with the facial vein and lingual vein sometimes, and they make the common facial vein. And this is the common facial vein that goes into the internal jugular vein. Sometimes the lingual veins join the facial veins before, and they too join the anterior division of the retromandibular vein, and sometimes facial vein joins the anterior division of the retromandibular vein. After that, the lingual vein joins them. But in any case, they join with the retromandibular vein joins the facial vein to form the common facial vein, and they drain into the internal jugular vein. Okay, moving on. So this is shown the same situation. The facial vein is shown a little more clearly in respect to the structures of the face. That is the supraorbital vein, supratrochlear vein joined from the facial vein. It is connected with the veins of the orbital cavity, moving on the lateral aspect of nose, lateral aspect of lip, moving through the jaw. Here it is joining with the anterior division of retromandibular vein to form the common facial vein, and it is joining into the internal jugular vein. And here superficial temporal vein is shown to receive maxillary vein to form the retromandibular vein that is dividing into anterior and posterior division. External jugular vein. External jugular vein, how it is formed. We just talked about retromandibular vein. In this particular picture, here is the retromandibular superficial temporal vein. This was the maxillary vein. They joined to form the retromandibular vein. They joined and okay. The retromandibular vein comes down. It divides into two divisions, anterior and posterior division. Anterior division was joining with the facial vein to form the common facial trunk. The posterior branch, it moves back, and posterior branch joins with this vein, the coming from the back of the ear. It has the same name. This artery, this vein is called posterior auricular vein. This vein is called posterior auricular vein. Posterior auricular vein joins with the posterior division of retromandibular vein, and they two join to form the external jugular vein. And external jugular vein, it goes down, it crosses vertically like this. It crosses from lateral margin of the sternocleidomastoid to the anterior margin of the sternocleidomastoid, and on sorry, it crosses from the anterior margin of the sternocleidomastoid to the posterior margin of the sternocleidomastoid, and just on the back aspect of the sternocleidomastoid, it winds around it and dips to join the internal jugular vein. Sometimes it may join the subclavian vein also as shown in this particular picture, but usually it joins the internal jugular vein and is coming down. What are tributaries it is receiving? Two tributaries are the one that are forming the structure, that is the posterior auricular vein and the uh, posterior division of the retromandibular vein. Apart from it, as you move down, you can see other structures joining it. These include the transverse cervical and superficial suprascapular vein, the ones that with the same arterial names of the arteries we discussed, and it may also drain the anterior jugular vein. So this is the external jugular vein. It is shown right here, and here the anterior jugular vein is shown. It is running on the anterior aspect of the neck, and the two internal jugular veins are joined with one another with an anastomosing arch. And this apart from this arch, a branch it goes laterally anterior jugular vein behind the sternocleidomastoid and go to join the external jugular vein. This was about the jugular arch. The this is the jugular arch. The anastomosing arch that joins the two internal jugular veins, anterior jugular veins, it's called the jugular arch. Internal jugular vein. So where does it start? It starts from the point where it exits the jugular foramen in the skull, where it exits the posterior aspect of the jugular foramen. From here, it goes down and it enters the carotid sheath. From that point it moves down the carotid sheath all the way down, and it ends where it meets the subclavian artery, and it ends where it meets the subclavian sorry it ends where it meets the subclavian vein to form the brachiocephalic vein. So this is the terminating point of it. So what are the tributaries it is receiving? So it is not shown in the very good in this particular picture, but as soon as it exits the jugular foramen, it receives the inferior petrosal sinus. You must be thinking petrosal sinus, it's inside the cranial cavity, but usually it fuses with that jugular vein after passing through the jugular foramen on the neck aspect. So its first tributary is usually the inferior petrosal sinus. As we go down, you can see different veins that are draining into it. There is ascending pharyngeal vein, counterpart to the artery. There is common facial vein, there is a lingual vein, sometimes through a common trunk, sometimes separately. Then there is spurothyroid veins from the thyroid, then middle thyroid vein from the thyroid, and these are the veins that are draining into the internal jugular vein. The relation of the internal jugular vein is a commonly asked exam question. Internal jugular vein, anteriorly, it is related to all the structures that lead to the skin. So if we move from front back, there is a skin, superficial fascia containing platysma, then there is this muscle, sternocleidomastoid, and if we move from up, um, sorry, if we move see from upwards, here internal jugular vein is behind this set of area. It is behind styloid. It is behind posterior belly of digastric. It is behind the angle of mandible. It is behind the parotid region. So all of these structures are related to it anteriorly. All of these structures are related to it anteriorly. So this includes styloid, posterior belly of digastric, and parotid gland. And anteriorly, it is related to the strap muscles, especially omohyoid, is just anterior to it. And very important point to remember is that the tendinous arch, where the two bellies of omohyoid meet, where the superior belly of omohyoid meets the inferior belly, this point is just in front of the internal jugular vein. And this is a very important surgical landmarks that help identify this vein. Then there is accessory nerve that is running in front of it. I think it is not very nicely shown here, but it may be shown. Yes, accessory nerve, it moves from front to back across the jugular vein right here. So it is shown right here. It moves from front to back right here, so it is anti-relation of it. And then there is deep cervical lymph nodes and ansa cervicalis that is moved from the anterior relation. So these relations we just talked about are both of the anterior and the lateral aspects. So these are more technically the anterolateral relations of the internal jugular vein. Posteriorly, which structures are related to it? Posteriorly, if we see through a radiogram, if we see through a venogram, it is related to the transverse processes. Just the transverse processes are behind it. Then there is a set of these muscles, the lateral group of prevertebral muscles, scalenus anterior, scalenus medius, and the highest point, levator scapulae. This is behind it. And if we consider looking through the scalenus anterior, cervical plexus, and in the lower part, brachial plexus is in the posterior relation. As internal jugular vein is running in front of the scalenus anterior muscle, so any structure that is on the anterior relation of the scalenus anterior will also be related to it. So that includes the phrenic nerves moving along the anterior surface of the scalenus anterior. That includes the prevertebral fascia that is adherent to the anterior layer of bone. Then there is vertebral artery, vertebral vein, and first part of subclavian artery. It moves behind it, and you can see the thoracic duct as it moves, jumps from back of the thorax over the subclavian artery and join the subclavian vein. It is moving behind the internal jugular vein too. So these are the structures that are related to the internal jugular vein. Medially, it is related to the internal carotid artery, and in between them there is a vagus nerve. That is the most common that you have to remember. That in medial to the internal jugular vein there is carotid artery. On the upper aspects there will be common upper internal carotid, and the lower aspects there will be common carotid, and in between them there is vagus nerve that is the throughout, and in the earliest part there is the rest of the cranial nerves, but they separate very quickly and very early, so you don't see this relation throughout. But in the very early parts, the rest of the nerves are always already also there. So this is all about the veins and the face and scalp. We talked about facial vein. It started by joining of supraorbital and supraorbital veins. We talked about ophthalmic veins joining them to cavernous sinus right here. Superficial temporal vein, we talked about it, and it accompanies superficial temporal artery and auricular temporal nerve. It joins the maxillary vein to form the retromandibular vein. They divided into anterior and posterior division, and it joined the facial veins to form the common facial vein, and posterior division joined the posterior auricular to form the external carotid that moves across on the superficial to the sternocleidomastoid. It received a number of tributaries and it joined, including the anterior jugular vein, and it drained into the internal jugular vein. And then they would talk about the relations and tributaries of the internal jugular vein. So that's all about the venous structures.